Well, welcome back to the Sam and Sim podcast, episode number 2. Today we're talking about abortion.
What happened to I'm Sam?
Wait, yes. Hi, I'm Sam.
I'm Sim.
There you go. And yeah, we don't mean to be laughing around about the topic about abortion, but we're sort of silly people and we have our laughter at different times. But yeah, the topic's about abortion. And rather than do a big, long, silly intro like last time, though, I do want to ask a question just to hook you into this a little bit. Most people listening to this would know us, would know our Christian background, and that we are opposed to abortion. But what if you personally, whether you do or not, I don't know, but what if you did have a strong conviction that led you to oppose abortion, but then you found yourself in a position where you had to have one? And that's the position that we found ourselves in early last year, 2022.
Not early, mid.
Mid to, well, yep. In any case, though, it proved to be more complex in some ways than we thought. And it was, a little roller coaster of an experience, I suppose. But, yeah, is there anything you want to say at this point before we... It's probably a good idea just to outline our position, why we believe that abortion in the majority of cases is wrong, and I guess what is abortion, because there's different things people might understand related to that or not. But so what is abortion?
It's the deliberate killing of an unborn child.
And so would you class what we had to do as an abortion?
Yes, I would.
Okay, but some people don't, do they?
Well, no, not necessarily.
Okay, that ambiguity will become a bit clearer when we talk about what happened. But we didn't want to do it.
Nope.
Absolutely didn't want to do it. But yeah, we'll get to that. So, I mean, why do we believe abortion is wrong?
Because we believe that life starts at conception.
Okay.
And all life is given and taken by God.
Yep. And in terms of the sanctity of life, we believe we're all...
persons are made in the image of God and therefore has value.
And it doesn't start from birth. It starts from conception. And why don't we say, like, it starts at a heartbeat or something like that, or second trimester? Why do we go back to conception?
Because at the meeting of a sperm and an egg, new DNA is created, which is the basis of the new human being's everything. So yeah, when the sperm and the egg meet, that's when the new life begins.
Okay. So there's sort of an assumption perhaps there in some ways. And I could imagine a pro-choice person saying, well, it's still not really a person until they've got a brain and some sort of sensory and a heartbeat maybe.
Yeah, but
I can tell you why I would go back to conception, but what would you reply to that?
I would say that we're creating human DNA, not monkey DNA or friggin' cat DNA.
Mm-hmm.
So what does that mean? If it's human DNA, is it human?
You say human really funny. But yeah, it's a complete genetic identity, something like that. I would say, murder is obviously wrong, and murder is the killing, deliberate killing of a life. We know that the baby in the womb has a heartbeat from 4 or 5 weeks.
Detectable
heartbeat
from about 5 weeks.
And that seems like a bare minimum, but none of the legislation operates based on detectable heartbeat, which would, I think, be perhaps a more common sense approach than some arbitrary. But for me, I would argue it in the way of, we're made in the image of God, every person, and I absolutely know from a heartbeat that's an individual living within the mother. I don't know exactly when life begins from the concept of a person in that, I don't know how to describe it way, but
when the
it amounts,
person gets a soul or whatever.
Yeah, where does that kind of happen? We know Scripture talks about being knit together in our mother's wombs, that God knows us even before the foundation of the world.
Doesn't matter though, because you err on the side of caution.
Yep, and that's the summary of my argument is err on the side of caution. And all of the pro-choice arguments ultimately fail if we understand that little life is a life, and it doesn't make sense even in the case of a really terrible case of conception due to rape or incest or abuse in whatever other form. Doesn't make sense to kill the victim, which is the baby that's been produced as a result of that. Maybe medical technology could come up with other ways of taking that embryo out of the mother and putting in a surrogate or something, but people are just not interested in looking at that angle. It's all about, freedom to choose and not acknowledging the personhood of the baby.
Yeah, it's all about doing what feels right to the mum.
Yep. And in most cases, the abortions are done by convenience and choice, and in the name of sexual freedom. They're not in those cases of rape and abuse and incest. But
it's usually it's not the right time. I'm not in the right financial position. I'm in a awful relationship.
Yep. And a lot of people would want to argue the point, and our point isn't to argue the point today, though. It's to consider our story, which, because you were bearing our little baby, is heavier weight on you. Do you want to outline what happened?
Yeah, I will. I found out I was pregnant in end of May, probably, of 2022. And we were excited. It wasn't quite planned. But we were wanting one more child to add to the family. So we were excited. I was sick as usual because I get quite sick during pregnancy.
How sick?
Sick enough that I need hospitalization throughout it. I suffer from hyperemesis gravidarum, which is excessive vomiting during pregnancy, and I find it really hard to eat and drink enough to keep my body alive. So well, it does keep me alive, but only just.
So just to delve into that a little bit, what happened with Gus's pregnancy and you?
I lost about 20 kilos of weight. I didn't have 20 kilos to lose, so just so you know, if I sat in the bath, my bum bones were so sharp that I couldn't do that. And all I wanted to do was sit in a bath. Anyway, so I was so skinny that it hurt to sit down. And the doctors refused to believe how severe it was, so I was never really treated except for getting fluids every now and again.
And the odd visit to the emergency department where they pump you full of glucose, was that with Gus? Or was that?
It was just because of low blood sugars, but my blood sugar would get so low that it would require an emergency visit to the hospital where they would put me in the resus bay to try and get my blood sugars up.
Huge syringe full of glucose. Glucose is a big molecule and it's quite painful to pump that in.
Yeah, it hurts to go in through your vein.
You had quite a trial on that.
Anyway, but in the end, they did some bloods and discovered how severely depleted my body was of micronutrients and electrolytes that I was on the verge of a heart attack.
Was that? Did they do that before we had worked out you were going to get a Caesar?
No.
Okay, so that was part of the decision making and accepting that we had an issue that they needed to deal with the level that we said that they should.
Yeah, so kind of we just tried to make the point really strongly that I wasn't able to keep anything down. And they tried an NG tube, but that just made me vomit more. And then they tried to give me feeding through my veins, but again they try and pump these massive molecules into your vein. Excuse me, I need to clear my throat.
We're laughing a little bit because the sounds of swallowing and everything go through drinking, slurping, go through the microphones really easily, and things falling on the table like that. And anyway, we're learning. We'll work out how to adjust the levels and stuff.
The parenteral feeding, which is through your vein, it hurts again. So it's like being in constant pain while they're trying to put some nutrients through your veins. I was almost 35 weeks pregnant at this time, so I just told them to just stop.
So we're still talking about Gus, not last year's
pregnancy.
Yep.
Yeah. Anyway, I just told them to stop, and I asked them to take the baby out because I needed to be able to eat. And my baby was not growing as well as he should have because I wasn't able to eat, and so he was at risk while I was at risk. And when they finally did bloods to sort of prepare me for an induction, they found that my electrolytes were so low that I was at risk of having a heart attack during labor.
Yep.
So they decided to do a emergency cesarean section under a general anesthetic because they didn't want to risk me having a heart attack on the table and then being awake for that. So they had a defibrillator in theatre as well, ready.
Yep. It was
Thankfully that didn't happen because they tried to put as much electrolytes,
potassium particularly, I seem to remember.
Yeah, into me before the surgery, only a couple of hours away. So I had that running the whole time before the surgery and throughout the surgery. And I survived the cesarean section, obviously, because I'm here.
Yep. So now there's another really important question that often gets asked, particularly by our parents and people close to us. Why have more children if it takes such a toll on you? I mean, that was with Gus, was the worst of pregnancies in that regard, I think. And I've said, we're happy to stop there. We don't need to have any more kids. We're not like trying to just pop them out as many as we possibly can. We sort of are because we love kids.
Well, that's the point. Yeah. Children are a blessing from God. Yeah,
the fruit of the womb a reward. But we do have to be wise, and we're not advocating that people put their health at risk. We believe that God gives people particular gifts or particular faith for particular challenges.
To be fair, we don't know how sick I'm going to be during a pregnancy.
Sometimes it's better than others. Yeah. But we have said one more and done after the last lot of experiences, and we want you to be around to help raise the rest of the kids. Do we talk about what's happening right now before jumping back to...
No, I think we should tell the story of Renee.
Okay,
so in May 2022, I was pregnant and we were happy, and I was starting to feel quite sick, which is normal. So, pregnancy nausea is kind of a good sign because you know that your pregnancy hormones are rising and the baby is growing. So it's always kind of a good sign when you're sick, even when it feels disgusting. Anyway, I took our homeschooled children to a homeschool gathering that we usually go to once a fortnight, and I started bleeding. And it was quite heavy, so I just assumed that I was having a miscarriage. and I just grabbed whatever sanitary products were available at the homeschool gathering and just used those while I tried to continue teaching my classes. But a friend came and I told her what was happening, and she said, look, I don't think you should be here. Maybe we should just take you to hospital to make sure that is what is happening. So I phoned Sam at work and said, look, this is what's happening. I'm probably just having a miscarriage, but not that I would call it just a miscarriage, because every miscarriage is a tragedy. But you'll understand why I'm saying just a miscarriage soon. So Sam came from work to look after the kids while they did their homeschool activities. My friend's husband came to look after their children while she took me to the emergency department at Waikato Hospital. There we had to wait a little while before we were seen by obstetrics, and they did an abdominal ultrasound and couldn't find a yolk sac or any embryo visually, but the bloods came back really high, the human chorionic growth hormone.
Pregnancy.
Yeah,
hormone.
so that's the pregnancy hormone that the baby excretes while growing in the uterus. Anyway, that hormone was really, really, really high, so I told them that there was a pregnancy, but they couldn't see it. So the obstetrician said, I think you just had a miscarriage and you're over the worst. And I didn't feel quite right about that because they did a cervix check as well, and that was shut. So I said to her, look, I don't feel comfortable that this is just a miscarriage, especially the amount of blood there was. Usually a miscarriage would happen over a period of days or sometimes weeks.
So what often people wonder, like, how do we talk back to the doctors or to the nurses like this and push? Well, because we've had a lot of pregnancies and
we've just dealt with the health system quite a bit, so I kind of knew that, I mean, I had options. I didn't have to take the word of the doctor and believe them. So I asked them whether we could do an internal ultrasound at hospital, but it was late in the afternoon already by this time that they saw me, and the ultrasound techs have already gone home. So she said that the quickest option would be to get a scan in the community, and I only could get that a couple of days later. So I went home, still bleeding, but not bleeding as badly as I was initially, but started bleeding again on the day that it was a Friday. 2 days later when I had to have the scan, so the poor scan lady had to do an internal scan on a woman who was bleeding. But anyway, she did that because that's what you do. And she found the baby. There was still a very strong heartbeat. And the baby was measuring around 6 weeks gestation. And the baby looked healthy. But the problem was where this baby was located, because my uterus was empty. There was nothing inside my uterus. The baby was also not growing inside my fallopian tube, so it wasn't a tubal ectopic pregnancy. But the baby was growing in the muscular tissue of the uterus. Now, if you know your uterus anatomy, there is a lining in the uterus, which is what sheds when you menstruate. Then there is the muscle tissue, which is what expands and contracts while you're in labor. And it also makes the uterus stretchy to accommodate a growing baby. And then there's the outer kind of layer that holds it all together. Anyway, the baby was growing in the muscle tissue of the uterus instead of growing in the lining of the uterus. That's why the uterine cavity was empty. And so when you have a cesarean section, there's scarring on your uterus or on the inside of your uterus, because they cut through your entire uterus to deliver the child. And Sometimes it makes a little bit of like a hollow on the inside of the lining of your uterus, which is a perfect place for a little embryo to attach and then grow into the musculature of your uterus instead of just attaching to the lining, which is what happened to us. It's called a cesarean scar ectopic pregnancy.
So what's in case people aren't sure, what's so dangerous about that, and how did that lead to the bleeding?
Well, as the placenta grows, it infiltrates the musculature of the uterus, which is what causes the bleeding. It's like eating away at the muscle tissue of the uterus.
Rather than being in the typical lining prepared for nutrition and whatever.
Yep. So, and the danger from that is not just the initial bleeding that you will have as the placenta infiltrates the musculature of the uterus, but is also that it thins the musculature, that muscle lining or the muscle layer thins as the placenta develops and as the baby grows, and the chance of a catastrophic uterine rupture is massive. So,
and the bleeding at such an early stage was an indicator that this was probably quite
a severe case.
Yeah.
Yeah, because the baby was so deep into the musculature of the uterus that there was only a very, very thin remaining lining left outside where the baby was growing, which was protecting the baby sort of from that outside the abdominal cavity. And yeah, that was what was holding my uterus together. So the scan lady sent us to the emergency department straight away. She phoned the obstetric team at Waikato Hospital to let them know that we were on our way and that I was such a high risk that they had to do something immediately. So again, I left Sam at home with the kids and I went with my friend to hospital just to find out. And on the way I was Googling as much as I can about cesarean scar pregnancies because this is the first time that I had heard of one.
Same.
Like every previous pregnancy after my first cesarean section with Emma Grace due to placenta previa, they had asked me if I had a cesarean section before and when they do the first scan, and I'm like, yeah, but why do you need to know that? And they don't tell you why. They just say, oh yeah, we can see cesarean scars on the scan. Not that there is a chance that a baby could implant in the scar and cause trouble for a pregnancy. So I think cesarean sections need to come with a warning, just so people know that this is a potential outcome after a cesarean section. Because all they tell you is that a cesarean sections is safe. Safe and effective, because I mean they are effective because you deliver the child in the end, but
and generally safe.
And generally safe, but they don't tell you about the rare
longer term,
consequences of having a cesarean section. Other than it's major abdominal surgery, but I mean that's the only thing they tell you. Anyway, my friend and I get to hospital and the obstetric team is waiting for me because I'm so high risk, so I don't have to get assessed in the emergency department. They just whisk me straight past everything and everyone.
And the risk is just, again, a sudden hemorrhage and bleed out.
Death.
Yep. Rapid onset of death.
Yeah, so they sit me down in a tiny little room and tell me that I have to terminate my pregnancy. That was my only option. And I asked what the chances are of carrying the baby until viability and then delivering an early baby, like 24 weeks, and having a long NICU stay, but at least having a chance to save the baby's life. And she said the chances are 0. If I carried the pregnancy any longer, the uterus would rupture and both the baby and I would die especially if it happened when I'm not in hospital.
Mm.
And we live about 30 minutes out of Hamilton, where the hospital is. And the wait times for ambulances are so long that unless you're literally dead, they don't actually come for about an hour or two. So risking going home and hemorrhaging here would likely lead to death of both me and the child.
I just want to pause and do a bit of a plug for St. John, though, because they've been really helpful in the past, and it's more in recent years as they haven't got the funding and the health workers and to be able to keep up the level of service that they've had in the past, I think. But anyway,
I would
that's
add to that mandates, but that is
course.
also a sidetrack to what we're talking about.
Yep, but just for anyone who works in that industry, we're not trying to get at you, it's just what it is. It's part of the consideration. But anyway, sorry, carry on.
Yeah, it's just something that you have to consider when you're at high risk and you live out of town, and you have to just consider the ambulance wait times if you're bleeding to death. Anyway, so that would not be an ideal situation, starting to bleed in Te Awamutu and having to get to Hamilton in order to try and fix a ruptured uterus. Anyway, so we had to make a decision whether to continue the pregnancy and just watch and wait, or to have a termination and pretty much stop the pregnancy, which means kill our unborn child, so that we could prevent a uterine rupture, which also would mean, either death for me and the baby, or at least the loss of my uterus. Which would be best case scenario. They were pitching me worst case scenario all the way because of the severity of the cesarean scar pregnancy, though.
So both lives lost, or terminating the baby was there,
and saving my life. Yeah.
That was pretty much the decision.
So we decided to have a termination so that I could remain alive for the living children we have.
And for me.
Well, yes, and for my husband, obviously. But, it's more important I stay alive to help you raise the kids than just to stay alive for the sake of you.
Yeah. No, I'm not joking, but there's sort of a bit of levity in there. Yeah.
Anyway, so they went ahead and prepped a theatre for me because the method of termination is not one of the nicest ones, because they couldn't go in and just suction the pregnancy or the baby out like they do with most first trimester abortions. So most first trimester abortions are done by doing a DNC, which is a dilation and
sweep.
No, it's a cutterage or something like that. That's the word.
C. Yeah, not it.
And it means to suction. So they literally use suction to suck the baby out of the uterus, which is disgusting to think about. But when they do that, they do use kind of like a spatula tool to scrape the placenta away from the uterine lining. But yeah, they couldn't do it in this case because that would risk
further rupture or
further rupture of the uterus. Because of the myometrium, which is the musculature, was so thin that they couldn't risk going in with instrumentation and causing a uterine rupture.
That would cause the thing they're trying to prevent.
So I was right about curettage. That's the sort of word they use.
Dilation and curettage.
Yeah.
Anyway.
Yeah. Anyway, So yeah, they couldn't do that. So what they needed to do was terminate the life of the baby to stop the placenta from growing. So when the baby dies, usually the placenta dies, and so it stops the placental cells from dividing as well, and it usually kind of shrinks back and then sheds. So if you would have a normal miscarriage where the baby in your uterus dies, the baby would die, the placenta would shrink and die back, and then it would detach from the lining of the uterus and shed like a period, which would not be just a period, would be an extremely heavy one because of all the placental tissue and the thickening of the lining of the uterus to accommodate the baby. So the method with which they killed our baby, which we allowed, I'll just say that. I didn't just, it wasn't done without our consent.
And we spent time talking as much. It was quite an urgent thing as we understood it, but we took the time to pray and consider any options and just wild possibilities of...
And consulted with people who we know in the medical field.
Certainly wasn't a light decision.
To see whether there were other options for us. But even those in the medical profession who were Christian themselves and pro-life and wouldn't consider an abortion as a normal option said that they would recommend having it. Anyway, the method with which they do it is to inject a chemotherapy drug called methotrexate straight into the amniotic sac of the baby. And essentially it dissolves the baby.
So methotrexate as a chemotherapy drug's designed to kill the cancer.
It kills any cells that it comes in contact with, basically.
Yeah, but because of the way cancer would grow, it would absorb into there and kill it. But cancer gets killed with chemicals, chemotherapy, and the person suffers side effects because it's nasty for all their cells, not just the cancer.
Yeah, but this methotrexate kills the rapidly dividing cells. That's why they use it in this kind of cases, because a baby is growing really fast. So it attacks all those rapidly growing cells and kills them. And essentially it dissolves the baby. So I had to go under a general anesthetic for that, and they don't do it through your abdomen, they do it through your vagina. Sorry, that's graphic, but they do it by ultrasound guidance, and they stick a large needle up and in there and through your uterus into the baby's amniotic sac and inject the dose of methotrexate in there. And this avoids having to go in with instrumentation to kind of disrupt the uterine lining.
And potentially cause a bleed,
Yeah, so that was done. And when I woke up in recovery, I cried. And I just asked the nurse, is it done? And she said yes. And she held my hand while I cried. Because I knew that the baby's life was terminated and it would now be gone. Sorry, I'm crying, so it's a bit wishy-washy now.
It's okay.
So the baby's life was terminated, and when was I sent home? The next day?
Pretty much, yeah. I think they wanted to monitor the decline of the amniotic sac or something, didn't they, and make sure
they did. And sorry, if you can hear that sound in the background, it's our decrepit dryer, which probably needs a belt replacement or something. But
if it goes, we'll replace it.
Yeah. Anyway, so they did a scan the next morning just to confirm that the baby was dead. Anyway, that was kind of traumatizing as well, because again they had to do an internal scan. They could still see the amniotic sac, but they could see no fetal pole, or no measurable fetal pole. You could still see kind of the
fetal pole.
A fetal pole is just the beginnings of the baby. So there's usually the amniotic sac, then there's a yolk sac, which is the start of the baby, provides the nutrients for the baby to grow before the placenta attaches to the uterine wall.
To provide the normal.
Yeah, so they could see a yolk sac, but they could see no fetal pole, which is where the baby kind of grows attached to its umbilicus to the yolk sac.
Okay.
You could see kind of like goopy. Oh, well, on an ultrasound you don't see goop, but you could see that the amniotic sac was opaque, so it wasn't clear anymore like it usually is on an ultrasound, clear with a clearly defined fetus inside.
Baby, yep.
Yeah, so...
it's probably worth just mentioning you have a year of pre-med as well, and if you catch, Sim's really good with the language and the drug names and the biology, the anatomy.
I just have a knack for it.
Maybe, but most people are like, what? And they, like when we're talking with doctors and nurses, you're speaking to them in their language, and that's always helped us interact with them, or maybe hindered because sometimes they feel like you're
a know-it-all.
An internet warrior or whatever, but you do have background with sports science and pre-med.
And then a biology degree.
Yeah, so, yep. And we both have science degrees, although mine's in physics, but we think about what they tell us, and if it makes sense, we ask them. If it doesn't make sense, we ask and probe a little bit until we're comfortable. But anyway, sidetrack.
Anyway, so for them, a good outcome is that there's no cardiac activity, which there wasn't. So there was no more heartbeat. Our baby was gone. And that was sort of the sign that I could go home. Because if there was still a heartbeat, they had to repeat the procedure. Anyway, methotrexate, interestingly enough, is a folic acid inhibitor, which means it makes your body not absorb folic acid, so they don't recommend getting pregnant after methotrexate treatment for at least 3 months.
After chemotherapy.
Yeah, so that you can get the folic acid that's depleted in your body back up to a normal level so that you can avoid spinal tube defects or neural tube defects.
Which folic acid prevents, so it's good to take it if you're trying to get pregnant.
Yeah. Anyway, that's also another sidetrack. Came home, but a couple of days later I started bleeding. Actually, it was on... Whose birthday? Was it Evelyn's birthday? Yes.
Yeah, it must have been.
It was Evelyn's birthday. So Evelyn is our middle daughter.
Turning 7. One of our middle daughters.
Yeah, one of the 2
child.
middle daughters. But yeah, so she has a birthday in June, and we'd arranged to have a combined birthday for her and her friend who were born on the same day, and they're the same age. So my friend Sarah and I gave birth on the same day. I was so gutted she took the last room at Riveridge Birth Centre that day, and I wanted to go there. Anyway, I didn't know it was her who took the room at the time, so I was a bit disgusted at the woman who gave birth like a few hours before me. Anyway, we later discovered it was Sarah, and it was all good. I was no longer angry, obviously, because I could go to the other birth centre, which is fine.
Did we find out because I was friends at that point with David, and
yes,
we knew that was David's daughter and put it all together.
Yeah, well, I let Jill know that I had the baby, and she's like, oh yeah, Sarah had hers just a couple of hours ago, and she's at Riveridge. I'm like, well, it's Sarah who took my spot.
Yeah.
Anyway, Evelyn had her birthday with Morris, who is Sarah's son, and they both were born on the same day, so they're the same age. And I had to prepare for her birthday at a local hall. And I started bleeding profusely that morning. Looking back now, I should have gone to hospital right at that moment. But I didn't want to. I just had enough of hospitals at that point. And I was like,
we knew it wasn't the baby was already gone. And
Yeah, so the baby was already gone. I just didn't know whether I was hemorrhaging or not, which I now know I was, but I just continued on, soldiered on for the day. The bleeding eventually stopped, or slowed down to a trickle anyway, but the amount of blood I lost was quite a significant amount, and you'll understand why soon, but so the bleeding settled down over the course of the day, and we had the birthday party. I felt yuck because I was bleeding and I felt quite faint, which should have been a sign. But I was determined to just carry on as normal as possible if I could. Yeah, so we managed to have a normal kind of ish day, even with me bleeding. But then that was the Saturday, and then on the Monday, I started bleeding again. And I had a phone number to the early pregnancy clinic at Waikato Hospital, who kind of monitor miscarriages and things, and they just touch base with their patients. And since I was one of their patients, one of the nurses sent me a text and asked how I was doing, and I said, actually, I'm bleeding quite badly, like soaking a pad every half hour. And they say if you soak a pad every hour or so, that is too much bleeding.
Get into hospital.
Yeah, so you have to head into hospital quite urgently. So yeah, I was soaking a pad in every half hour. And she said to go in. So off I trotted again with a friend to the hospital. I don't know, did I go in myself this time? I don't even remember. Yeah. I think I possibly did go in myself this time. And when I got there, I had to wait for obstetrics again while I was bleeding. And bleeding quite heavily. I had a male nurse, the poor guy. I had him check the toilet after I went because it's blood everywhere. It's like, look, I just want you to check because I feel like this is a lot of blood and I'm still not seeing obstetrics. Mm-hmm. And as he was looking, I was just saying, I'm sorry. And he said, it's all right. It's kind of part of the job. So eventually I see obstetrics and they give me a few options, which is wait and see and probably bleed a lot again and need to come in anyway for a surgery or just have the surgery immediately. And I decided to have a surgery immediately.
What was they saying the surgery was for?
Well, what they were saying, they did another scan. So they did another internal scan, and what they could see there that the yolk sac or the amniotic sac was still there in the uterus, and the placenta was still there.
There was no baby.
No baby anymore, but still an amniotic sac and a placenta. So the problem was that the methotrexate didn't work and to reduce the placental size as they thought it would. I actually had a intramuscular injection of methotrexate as well after the initial dose. You have to go in and get your bloods done a couple of days later. I think it was a week later.
Okay.
A week post the first methotrexate into the sac. And I know I went to the hospital myself to get the bloods done, and then they rang me to tell me that my pregnancy hormones haven't fallen.
Not enough, eh?
Yeah, haven't fallen enough. But she initially just said, "Oh yeah, you can go home.
And we'll look at it in a couple of days again.
We'll look at it in a couple of days again." But the obstetrician, because this was the registrar, so this is an obstetrician, but only specializing in the field now. So she had to ring a consultant, which is a higher up person. Yep. And so the consultant rang me back to say that actually it has only fallen a few points, so she wants me to come back for another injection of methotrexate. Now, I didn't understand whether this would be into the sac or into the muscle tissue at the time, but I took another friend with me who was pregnant at that time, actually, to hospital. I asked her if she would come with me just so I didn't have to go alone. It was kind of nighttime-ish. I think it was on a Saturday as well.
We often send you with a friend to hospital because our kids,
It's just
particularly
easier.
the smaller kids, can be pretty finicky and difficult.
Yeah, so it's just easier if one of the parents looks after the children to provide some stability to the kids. Anyway, off we trotted again to hospital, and I had another stab, this time in my bum, of methotrexate. And
they kept you in hospital this time.
Only 20 minutes.
Oh, wasn't it? Okay.
Yeah, it was only 20 minutes just to monitor you, just like they would with any sort of injection you get from.
Right. But they weren't
from the
concerned
GP.
that with all the bleeding that.
I wasn't bleeding at that point.
Right. Okay.
It was about another week later at Evelyn's birthday that I started bleeding.
I'm talking about from. So between the first methotrexate that killed the baby.
And the bleed,
And,
I had a second dose of
dose, okay.
methotrexate. I just forgotten, so I had to insert it here.
And then going back after Evelyn's birthday, that was when the options were either leave it and wait or have a surgery.
Yeah, have a surgery. So I chose to have the surgery. And initially that was an option to either get methotrexate injected into the amniotic sac or get a surgery. But the reason I chose methotrexate,
The first
after initially asking whether they could just do the surgery so it could be over and done with and we could move on, was that they recommend a year-long waiting before getting pregnant post uterine surgery, and so we wanted to have another baby. And I thought the methotrexate treatment would be the quickest option to provide us with the ability to have a baby sooner. The reason I wanted the surgery initially was to deal with a problem quicker.
Yeah.
Because it would resolve the pregnancy then and there, whereas they told me that methotrexate could take months.
There was also, correct me if I'm wrong, but a risk of bleeding during the surgery having to cause hysterectomy or something, or
yes,
affecting fertility? Yeah.
They reckoned that the surgery would have been higher risk and they could potentially rupture my uterus during the surgery, and then they had to remove my uterus anyway. But I still wanted the surgery. But the problem was at the time when I said, look, I want the surgery, please book an OR so that we can do the surgery. They didn't have a second surgeon. Sorry, this is just part of the ridiculousness of our health system at the moment. They could do the surgery, but not with one surgeon. They had to have a second pair of hands, and they didn't have that. And they also wanted to do it fairly quick if they were going to do the surgery, because I was at risk of rupturing. So we didn't really have that option in the end. So why they even gave us the option of surgery, I'm not sure. Anyway, so we had to go with methotrexate even though I wanted the surgery. But kind of the stick in the wheel of the bike is that I had to have the surgery anyway.
After the methotrexate didn't resolve everything fully.
Trexate didn't resolve everything, and after I hemorrhaged. So I had to have the surgery anyway. So it would have been much easier just to wake up a surgeon or get them away from their home over a weekend and do the surgery to begin with. It would have wasted less taxpayer dollars to begin with.
Yep.
Anyway.
Poor surgeon for, but a bit of an emergency scenario. Maybe they're used to that, but in any case, that's what it was.
Yeah, so they had to do a surgery. It's called a wedge resection. And what they do is they go into your uterus laparoscopically and vaginally. Vaginally with the instruments, but laparoscopically with some grabby tools to move things out of the way and stuff. And a camera. So a camera goes through your belly button, and two kind of grabby things goes through your abdomen so that they can
all
move
the gestures of where they're going in at the moment. So yeah,
move your uterus and your bladder and stuff out of the way.
Do we need to do a caution at the start of this, like to warn people about the details?
I don't know, but it's like crocodile clips almost.
Yeah,
if you
and you're making crocodiles with your hands as you.
Yeah, if you're an electrician or an electronics person, you know what crocodile clips are.
Yep, the things you clip onto the battery terminals when you jump start the car or something like that. But
so
smaller.
anyway, it's crocodile clips that go into your abdomen.
Yep.
And
Tiny
they
ones.
just use as an extra pair of hands basically to move things about, and the camera so that they could see that they weren't cutting through my uterus, which is what we wanted to avoid. Anyway, they managed to do a wedge resection, but I hemorrhaged during the surgery. And because I have a blood clotting problem, they couldn't give me tranexamic acid, which is what they usually use to stop the bleeding.
A clotting kind of support, I suppose.
Yeah, it's a clotting support thing. It helps the platelets bind together to clot the blood. But because I have a history of blood clots, they couldn't give that to me. So they had to find another method to try and stop the bleeding by still trying to preserve my uterus, which is what I wanted.
And they did, which was amazing. Yeah.
They did. So they blow up like a balloon inside of your uterus.
To apply pressure and stop the bleeding. Yeah.
To apply pressure to the wound and stop the bleeding. It's like wrapping a tourniquet or putting a pressure bandage on an open wound.
Pretty clever
to
idea,
stop the bleeding.
Yeah.
But if that didn't work, they were going to do a hysterectomy. But while I was in recovery, I was still bleeding quite badly, and I was in so much pain because they gave me Syntocin, which is artificial oxytocin, to help and contract my uterus.
To help push out all the sort of...
No, it was just to contract the uterus, because if it shrinks down, it kind of shrinks down the wound.
Yeah.
But yeah, so Syntocin is artificial oxytocin. That's the drug they give you when they induce labor as well. And they were giving me quite high dosages, and I didn't know why the heck I was cramping so bad until they told me. It was worse than giving birth. I was in so much pain that I stopped breathing quite a few times just because of the pain. And they would have to kind of come and rub me to start me breathing, because I was on the verge of fainting. My oxygen saturations would drop. My heart rate would go extremely high.
I think I spoke with you on the phone while you were in that condition.
State.
And it was, you were sort of lucid and then would drop out as you focused on managing pain.
And the stupid drugs weren't working.
The pain relief, you mean?
Yeah, the pain relief, because they were giving me morphine, and I think they tried ketamine in the end as well to try and relieve the pain. But the only thing that worked was when they eventually removed the balloon catheter from my uterus. And then it was kind of the biggest relief you've ever felt. So I was in recovery for 6 hours, which is a really long time to be in recovery for. Usually you're there for an hour max and they ship you back to the ward. But because they had to make sure my bleeding was under control, because if it wasn't, they would take me straight back to theatre. And also make sure my pain was under control, which it wasn't. And I was breathing normally. They kept me there for 6 hours. Yeah, and the poor nurses coming and going had to just keep rubbing me to make sure I was breathing.
Wake up, prod, keep breathing.
Yeah. Anyhow, miraculously, the bleeding had stopped. So They could remove the balloon catheter, and therefore the pain stopped, and they could move me to the ward. But because of my clotting disorder, they should have been giving me Clexane, which is an anticoagulant. Especially after surgery. After a surgery, you're at very high risk of developing blood clots.
Because that's part of the normal healing process. But
Yeah, and so most people, as long as they can ambulate, they are okay.
what's ambulate?
It means to walk.
Oh.
Ambulation.
Why didn't you just say walk?
Well, because that's the term they use in hospital. Anyway, so as long as you can ambulate, you're usually okay. But in my case, I had these kind of weird leg pumps on. They strap these things around your legs, and they pump air into these little sacks
sort of
in
pressure
the
to prevent
thing.
clots or something.
Yeah, so I had those on, and but I wasn't. They weren't giving me Clexane, which I asked about. I asked them, look, should I be on Clexane? But the reason the obstetrician at the time decided not to give it was because I could potentially start bleeding again if he gave me the Clexane. But in hindsight, you would rather manage the bleed than have the potential risk of a blood clot. Because while I was there, I developed another pulmonary embolism, which is a blood clot in your lung. And
You'd had several before that, so you had a pretty good idea of
what it felt like. And with my blood clots in my lungs, I never desaturated, which means my oxygen levels were always within the normal range, on the lower side of the normal range, but within the normal range, so they never panicked. Never panicked, but I knew something was not right because my breath was never satisfying when I took a breath. I mean, your lungs expand the normal way, but because the blood flow is restricted, it makes it hard to oxygenate your blood. Anyway, so I knew what it was, but I asked the doctor and I said, look, I'm having chest pain and it's not going away. I think you should scan me for a blood clot. And he said, no, I don't think it's that. I think it's just shoulder tip pain from your uterus, because you can get referred pain from your uterus to your shoulder because of some nerve system that runs up on the inside to your shoulder. Anyway, and I asked him again before discharge. I said, look, the chest pain, or it was kind of in my upper shoulder blade area. That's why he thought it was shoulder tip pain. But I said to him that, no, I think this is a blood clot. Are you not concerned? I can't sleep. The pain is bad. Please scan me. And he said, no, it's fine. It'll go away in a few days. So I was discharged home, but because I had a surgery and a small toddler at home, I decided to go recuperate at a friend's house so that my children wouldn't jump on my tummy, which just had incisions made in it and, cause havoc with the healing, etc., etc. But while there, I still had this niggly feeling that I had a blood clot and the pain wasn't going away, even with the pain medication, which was oxycodone. So you'd think that oxycodone would relieve your pain, but it wasn't relieving the pain. And I couldn't sleep at nighttime because, one, I was worried I was going to die in my sleep from a blood clot, and two, because of the pain. So on the Sunday, I asked her to just take me to hospital. We actually went to Anglesey Clinic first, and
which is a sort of a local accident emergency medical clinic thing.
Yeah, but the problem was this was still when people were a bit COVID mad. So one, you had to wait outside, and two, the wait time was over 6 hours. I was like, look, this is sort of kind of an emergency, but I just want the doctor to check me out and say, yep, here's your quick ticket to Waikato Hospital. Miss the emergency department.
Which would have a similar wait time anyway, maybe. But
yes, but usually if you get whisked from the A&E to Waikato Hospital, they can whisk you past.
Yep, and it reduces the load of patients on the hospital end for massive emergencies and all of that. Trying to be considerate, but yeah.
Anyway, we decided to call an ambulance because that would be the quickest way to get me to hospital. Ambulance actually surprisingly arrived swiftly, so we thank St. John for that one.
We're subscribers. And your subscribers, since we had all the issues with Gracie, which is probably another podcast to talk about. But
yes.
Yeah.
Anyway, they arrived swiftly. They put me on oxygen, and I told them my history, and I told them the pain that I was in. So they were pushing morphine via an IV access to help me. And so they took me straight to hospital. But there I was left for well over 14 hours.
With no treatment?
With no treatment. No Clexane, which would have been the first course of treatment. No scan, no nothing for 14 hours in a hallway because all the rooms were full.
Mm-hmm.
So that means no buzzer for a nurse. In a gown because they were expecting someone to come and examine me very quickly with an open back. So they make you take your clothes off and put a gown on so that you can get examined fully by a doctor.
In a hallway?
In a hallway. And you have to walk to a bathroom. So every time you're kind of flapping your buttocks at people. I mean, you hold the gown, but...
It's very undignified and this is all... personal trauma while you're coping with the grief of losing
a
the
baby. Yeah. So after that amount of time, they decide that yes, they have to scan me after being seen finally by a respiratory doctor. This was 14 hours, but they didn't have a scan machine. Oh no, they didn't have a person available to operate the scan machine at that time. So they finally admitted me to a ward.
Keep you overnight until someone was available.
And they finally started treatment up there. But the ward was so busy that they were kept forgetting my medication at the right time. So I had to repeatedly, luckily I knew I had to have it every 12 hours.
This was the Clexane?
This was the Clexane.
Yep, they finally got to that.
So if I was in pain, I also had to press the buzzer because they would forget my pain medication. But I also had to press the buzzer to remind them that it was time for my Clexane because they were so busy and they would delay it with several hours, which increases your chances of clotting on top of a clot.
Yep. And, I mean, they were overwhelmed and they're generally really awesome people. They're just very overwhelmed.
Yeah, so it's not their fault, but you need better systems in place to make sure that your patients get their medication at the right time to prevent complications.
And one of the problems is when there's a handover for a new shift, you have to explain to them, no, I didn't get my medication at this time, and there's no notes in the
patient files.
And so they're already overwhelmed, but they're having to go around in circles just checking and double checking that you haven't been already given a dose.
And fixing other people's mistakes.
Yeah. So it's compounding and anyway.
But after 2 days of Clexane treatment, they finally had a person to operate the scan machine. So I finally had a scan, and there it was glaringly obvious that I had more blood clots. And the type of clots I get are usually not massive big ones that block an artery or something, but they block several of the small blood vessels in my lungs, and they happen on both sides. So this was, again, that. They could still see the remaining clots from my previous blood clot, which happened while I was pregnant with Gus.
Yeah, which they'd already finished the course of treatment, but they hadn't. They'd cleared you without actually checking properly. Again, another system error.
Yeah, so it was obvious that I had a blood clot, and so the obstetrician, whom I said that I wanted a scan for a blood clot, he was wrong, pretty much.
And he should have listened to the patient who had several clots and knew what they felt like. But in any case,
Any case, we were on the treatment, and while I was there, they changed me to an oral medication that would be easier to take, but that you're not allowed to fall pregnant on. So we were in a bit of a dilemma of whether to, I don't know,
But after
stuff it anyway.
After the surgery, it was recommended not to be pregnant.
Well,
for
I had
3 to 6 months or something.
No, I had an obstetric appointment.
Cat's playing with my feet.
Oh, well.
Good timing. Little cat, newish kitten. Yeah. Anyway, sorry.
Anyway, I had a
No
follow-up.
edits.
Yeah, I know. I had a follow-up obstetric appointment at the early pregnancy clinic because I wanted to talk to an obstetrician about future options of pregnancy. And I actually kind of probably thought that I was an idiot because I said, look, I want another baby and ideally I'd like to have a pregnancy where I could have a VBAC, which is a vaginal delivery after a cesarean section. And she I said it laughingly because that's what I genuinely wanted, but I knew what her reaction would be to her. So she's like, since you're laughing, I'm assuming you know I'm going to say no.
Mm-hmm.
I was like, yeah, I kind of assumed that, but I can just try. Because usually you can actually, it's not recommended in New Zealand, but I know it happens quite a lot in the United States, is that women have 2 cesarean sections and then after that, they have a normal delivery because your risks of having a normal delivery after 1 cesarean is similar to that of having a normal delivery post 2 cesarean sections. There's not a lot of studies done on it because you know that they'll have to do it after the fact, not before the fact. So you have to do like a retrospective study on the numbers. But there's not a lot of studies on that, but from the studies that I've read is that the risks are very similar. And so I said that to her and she said, yeah, but you kind of had 2.5 cesarean sections because I had the surgery. Anyway, I kind of ignored that bit and just asked about pregnancy in general.
Yep.
And she said that her recommendation would be not to get pregnant for at least a year after the surgery to give my uterus time to heal to reduce the risk of uterine rupture with a growing pregnancy. But she said that she couldn't give me data to support her
General feeling about it.
Yeah, her general feeling about it. And she said a lot of obstetricians would have different opinions on it. Some would say 6 months, some would say a year, some would say 2 years. And just she falls kind of in the middle.
Take a cautious but not overcautious kind of
approach.
It's good to get the full picture though. This is what someone else might recommend and this is what someone else might.
Yeah. So... And she also said to check with the the hematology team on how long they want me on anticoagulation before trying to fall pregnant again. And their recommendation was 6 months. They would have no problem for me getting pregnant after 6 months of treatment because then you've done your full course. And they were happy for me to remain on anticoagulation at a lower level forever, pretty much, because I said I'm not coming off the damn stuff again because
I've had it fully in the way that they said.
No, and I have had 3 pulmonary embolisms. I don't want any more. So anything that could increase my risk of clotting would potentially cause it. So I'd just rather be on the stuff forever. Anyway, but the oral anticoagulants that I was on, the coagulants I was.
Well, was.
Yes, I know, it's weird. English is dumb, sorry. That was a loud swallow.
It was, sorry. I was laughing at the
You're
same
not allowed
time.
to fall pregnant on them because they haven't tested them during pregnancy. They cross the placental barrier. So, I mean, they don't really know the effect it would have on baby and how much of the medication would be crossing the the
Cat is
placental
very
barrier.
loud, sorry.
Stop interrupting me.
The cat's interrupting.
Yeah, but you don't have to say it into the mic.
Well, just in case people are wondering about the noises in the background. But anyway, okay.
Yeah, so the anticoagulation is not tested during pregnancy. That's pretty much the end of it. So you'd have to transfer onto a low molecular weight heparin, which is Clexane. Anyway, that's injections into your tummy, yes,
Yep.
because that doesn't cross the placental barrier.
Yep.
But Sam and I, we got pregnant just before I saw the hematologist again. So we actually got pregnant while I was on oral anticoagulants. So, yes, I'm pregnant. There you go.
Woohoo.
That's the news.
Yeah.
I'm pregnant with our 8th child. But hematology changed me to Clexane like 2 days after we found out that I was pregnant. So I was only on the medication for a short while before changing to the injectable anticoagulants, which I'm still on and will have to be on till after I finish breastfeeding, if I breastfeed this child, which I probably will, but I don't know.
Yep.
Oral anticoagulants is so much easier, just so you know. You just have to take a pill once a day.
Rather than inject yourself and have all the bruising associated with it. And
Yep, so that's why I'm saying I don't know how long I'll last on with breastfeeding, because it depends how long I can
put up with
needles, injecting myself every day.
Yep. And again, just reiterating, it's, kids is a really big deal for us. Other people devote their lives to their, careers and building a bit of an empire or whatever. We see our empire as in our children. Each child that we can produce and raise well is contributing something valuable to society, coming hopefully from a healthy, well-grounded home, grounded in morals and discipline, self-discipline, and all those sorts of virtues that come straight out of Scripture. And we just love kids. We love having kids. But this will be our last pregnancy, one way or another, and everything seems to be going well so far.
Yeah, so I just wanted to say that we've had a lot of people pray for us
and we're
about
really,
this.
really, really grateful for that.
Yeah, so a lot of prayer have gone into the decision of whether to get pregnant again in the first place. And then after we found out that we were pregnant, or while we were trying, people were praying that this pregnancy would be in the right place and the baby would be healthy, and that I would have a better pregnancy since I was so sick with my 2 previous ones. I mean, 3 previous ones if I count little Renee that we lost. But
we don't know whether the baby was a boy or a girl, so we chose a name that could
work for
equally
both.
apply. Yeah. So
lots of people prayed for us that this pregnancy would be better and that it would be in the right place. And I just had a scan. When was the scan? Was it on Friday? Yeah, I think it was Friday.
Yeah.
So today is Saturday. What? So I had the scan yesterday.
Was it yesterday?
No, I had it Thursday, 2 days ago. Yeah, it was Thursday. Sorry, I just have to think. This time of year I lose a bit of track of which day it is when.
Yeah.
So I had a scan on Thursday, and as soon as they put the sonographer put the wand down on my tummy, she could see that the baby was where it was meant to be. Well away from my cesarean scar. Strong little heartbeat. And measuring exactly at the gestation that I knew I was, which is amazing. That's never happened. So I was 7 weeks, 2 days when I went for the scan, and the baby measured exactly 7 weeks, 2 days.
So we're 7 weeks, 4 days now.
Yep.
Yep.
And I haven't been as sick this pregnancy as I have been with Gus and as I was with Tilly. I'm still vomiting every now and again, but I'm managing to keep some food down and enough fluids that I don't need to go in for fluid therapy.
Yeah.
Um,
Long may that continue.
yeah, and I'm only managing that because I'm having anti-nausea tablets 3 times a day.
Which does make you sleepy too.
Yeah, it makes me really sleepy, but at least I'm not chucking my guts.
Yeah.
So far I haven't lost 10 kilos, but I've lost 4.
We don't want that to continue on that trajectory, but
yeah, it's less than the last pregnancy, the early stages of the last, or with Gus's pregnancy. So that is sort of positive. I also feel in better spirits because I'm not constantly hanging over the toilet bowl. I mean, occasionally I'm hanging over the toilet bowl, but not consistently. Like with Gus, I could have made my bed there.
Yeah. You have been a lot more positive and a lot more patient with the kids and all that kind of stuff, which is when you're nauseated and tired, that's a difficult thing to manage. But
yeah, because all you want to do is sleep because that's the only time you don't feel like throwing up. So with Gus, I didn't manage that very well. With Gus, I pretty much slept through the whole pregnancy.
Had a lot of time off work.
Yeah, so I slept through the pregnancy while hanging over the toilet bowl for the rest of the time. But yeah, so this time it's kind of a deliberate effort to keep myself a little bit more chirpy as well.
Yep, early stage, do as much as possible to keep energy up and intake and positive.
Yeah, and also sort of to keep my mind distracted from the feeling nauseated. Because I'm constantly nauseous, like it feels like I'm car sick the whole time. So if you ever experience car sickness, being on the edge of vomiting the whole time, that's how I feel constantly. So it is probably hyperemesis again, but not to the degree that I had it with Gus, which I'm thankful for, but it's still not awesome.
Well, sort of not to wrap up too quickly, but there's probably another little angle to approach this with our kids. And is there something else you wanted to say first? Well, I wanted to get on to just talking with how we approach this with the kids and the mandarin tree. And
I just wanted to ask a question.
Yeah.
Did we do the right thing?
Yeah. Okay. Well, this is hindsight is a wonderful thing. A little bit sarcastically there, but in the process of going through this, working out what our options were with the information we had at the time, I think we approached it, and we have a very clear conscience before God that we made the right decision.
With the information
the information we had. But since then, you've discovered some people that sort of have more information and support group sort of stuff. And
well, I found a Facebook page that is called Continuing Caesarean Scar Ectopic Pregnancies. And in this group, the women who have kept their pregnancies or continued their pregnancies instead of terminating are all there. Most have had good outcomes, but most who had good outcomes didn't have the degree of severity that I did. Most of their babies were kind of implanted on the caesarean scar sac.
We've got a little monkey joining us. But
yeah, come Tilly.
Come Tilly. Come have a cuddle with whoever you like. She's going for Mama. We'll have a little cuddle and then go off to bed, I'd say. Yeah.
So, yeah, most women had their babies implanted on the sac, but not in the musculature of their uterus, which means the baby kind of pops out as it grows into the uterine cavity and doesn't grow solely inside the musculature of the uterus. But after finding that page, I doubted whether my decision was right in terminating the pregnancy. But I think that we probably would have had the same outcome, but just at a later gestation had I decided to continue watchfully waiting.
So what they do, I think, again, correct me if I'm misunderstanding, they would typically, where people would try and save the baby, they would keep you in hospital and monitor you for a few weeks and look for that, the baby, the sac and everything to pop out of the musculature or out of into a safer place, basically.
Well, yeah, but they also check on how thin your myometrium is. So they measure the musculature of the uterus. So yeah, they would have kept you there, monitored you for bleeding, and just sort of watchfully waited to see the pregnancy sort of announce itself.
Should we send Tilly off?
Do
Tilly,
you want to go to my bed?
You want to climb in Mama's bed? Okay. All right.
But yeah, if I could make the choice again, I would probably decide to continue the pregnancy for a wee while anyway, to see whether the baby would start growing where it should, and whether there would be any more catastrophic bleeding.
Nutmeg's frightening, Tilly. Do you want to run or shall I?
You go.
I'll go. You keep talking.
Oh, Sam, you made a lot of noise there. Sorry, the cat was frightening the small child, so Sam had to go rescue the child from the cat or the cat from the child. I'm not sure which way. But yeah, so I would have continued the pregnancy for a while longer anyway, to wait for it to reveal itself, really. And my instinct is that it probably would have ended in exactly the same way as it did before, but potentially with a uterine rupture and me needing a hysterectomy. Yeah, but that's just sort of the choice we made, and like Sam said, the value of hindsight. Yeah, I'm just happy to know that there are some women who decide to keep their cesarean scar pregnancies and continue their pregnancies to a stage where their babies are viable. Like I said, it is mostly women who have had lesser grade cesarean scar pregnancies to me, but I'm just happy to know that there are some doctors who are willing to let their patients try and keep their baby. It's not always possible, but it is in some cases. But yeah, I still think we made the right decision at the right time.
I'm back.
Terminator.
What, the cat, you mean?
No, you, Terminator. I'm back.
Oh,
or
sure.
I'll be back.
Sure. That was, I mean, yeah, okay. And the discussion of abortion and termination, that's, yeah. Sometimes humour gets a little bit dark as well. And yeah. Anyway, so jumping into how we spoke with the kids about everything, and because the kids knew when Mama gets sick, Mama's pregnant, so they knew Mum was having a baby, had a baby growing in her tummy. The older ones had a bit better idea of what that meant.
And where that came from.
Yeah, well, when the kids turn sort of 7 or 8, depending on the kid, we have a bit of a conversation with them about where babies come from, and
just the basic mechanics.
Yep. But they all knew there was a baby growing in Mummy's tummy, and then Mum had to go and get an operation, and the baby died basically. We explained in more detail, I think, to the older kids what was going on, and we'll give them a more, maybe they can listen to this when they're a bit older to get the everything. But we wanted to, like, we'd collected the remains of Renee, and there's more detail I could get into with the morgue and all that kind of stuff if you need to, but we'll probably skip over that for now. But we had the remains, and we wanted to do something special because have a funeral essentially, but you don't typically have funerals for such an early loss of a
unborn
baby.
babies, yeah.
But we had a mandarin tree, mini mandarin tree or something.
Yeah.
I think, but we planted it, and
You and the kids did
because
because
you were
I was
still
in
in hospital. And we explained again to the kids what was going on, have a bit of a biblical lesson and grounding our processing of the grief within our faith, so that they would learn how to do that too. We trust God. He's brought this situation along, and we know that He's working something in us for our good and for His glory. So we don't need to freak out and suffer without hope. We do believe that we'll see Renee again in glory. We trust that, our confession says elect infants who die in infancy are with God, basically. And we don't really have any solid answers on that, but we can trust a God who is good and who delights to save sinners like us. We explain that all to the kids and ground our grief and our trust of God and our hope for the future. And we planted this mandarin tree as a bit of a remembrance. There's nothing special about a tree. There's no kind of idolatry towards the tree. When we move house, if it's planted here, we'll just leave it here. Maybe we'll take it, depending on how big it is.
If it's in a pot, I'll take it.
Yep. But it's a reminder of a little life that was made in the image of God and has since passed on in God's timing. The remains were put in the pot, and so to sort of, that might sound a bit kind of gross, but in some ways, but where Adam was formed out of the earth, bury the bodies in the earth. Anyway.
Plus, there wasn't much there.
No, it's a small pot. It's very sad. We did record that and maybe put a link to that
video.
Yeah, we'll have another perusal of that, and we did share it with a few close people at that time, but we didn't really make it very widely known. I don't think a lot of people know that we were pregnant and that we went through that at that time.
Mostly just
close,
some people at church and close friends. We hadn't actually even told our family.
Yep. Yeah.
I didn't tell mine. I told mine when
after
I lost Renee. Yeah.
Yep. So I mean, the kids seem to deal with it quite well. They're still quite young, and they just know there's some drama going on, and we're including them in it, and they know that we love them, and they had a little brother or sister that they won't meet in this life, we talk about Renee sometimes, and they know what we mean.
And they like watering Renee's tree.
Yeah. Yep. So, that's a really helpful way, I think, of processing this, having a sort of a funeral and praying together and marking the passing of a life. And where we're at right now, I guess we're still, grief is different perhaps if you know someone for a long time, if you're married to someone for decades, or if you've, someone dies after many years of life, versus not really getting to meet this child. But there's still a real grief there. There's still a real sense of loss, and we do continue to carry that through. There's a tinge of sadness to the joy of this pregnancy.
Weirdly, I found that I didn't know this about grief really, is that you can be okay most of the day, but then it just hits you out of nowhere randomly throughout the day.
Yes.
As I remember, I was driving to a watercolour session.
Painting.
Yeah, so I was going for a watercolour painting lesson. And on the way there, I just had to stop the car and have a bit of a cry.
Mm.
And then continue on my way. So yeah, I didn't really think that it was going to hit me just randomly out of the blue, but it did.
I have the same thing, just getting lost in my thoughts. Still mind on the job at work, driving a forklift around or whatever, and just sort of all of a sudden hit with the weight. Oh, we lost a baby. And it was interesting to consider that and how we react. We don't really know ourselves how we're going to react, and I think it's humbling in a lot of ways.
Can I wrap it up?
I was going to say, is there anything else that you want to say? Or
yeah. Well, the last thing I would like to say though is that we are anti-abortion. That would be our stance if someone asked us. But in the case of saving a mother's life, I think it's a reasonable thing to do.
Yep.
So we believe it's okay to save a mother's life if the mother's life and the baby's life would be lost if you didn't intervene.
Yep. We're erring on the side of the most life saved, essentially. I don't know if I put that right, but
I don't know. To me, I was thinking about it, as self-defense. If your life is in danger and your life's in danger from your child.
Very real danger, not some vague.
Yeah, not vague
mental,
danger like some people terminate their
feel bad.
babies when they have hyperemesis like I do just so that they can feel better. That's not something I would ever consider in my life, is to terminate the life of a child because I was hanging over a toilet bowl.
It depends on that. For a different person, that might present a greater risk to their life. So there is a grey area of conscience where each person's got to do it
I
right before God.
understand that. If you're not at imminent risk of death from the hyperemesis, though, that is not something I would consider doing ever.
Yeah.
But yes, if my life was at imminent danger again from a pregnancy, I would consider it again, but it's unlikely that I would. I would probably risk my life because this is our last pregnancy anyway.
It's also, in the situation we had, ectopic pregnancies are fairly rare, and caesarean scar ectopic pregnancies are way rarer as well, aren't they?
0.03% of all ectopic pregnancies.
Caesarean scar. And how many percentage of pregnancies are ectopic?
I don't know.
Vanishingly small
1 in
already.
10,000 or something.
So you're looking it up?
Yeah, I am.
Yeah. So this was a very, very unusual situation in any case. But we're opposed to abortion. It's grounded in that baby being made in the image of God, and we don't murder people. We don't kill people for any reason. And it's just these very unusual edge cases where if we don't kill the baby, then the mum and the baby will die. That seems to be... There may be other scenarios that we don't know about or haven't considered, but the ethical question is always an issue of, is it okay to murder or to kill? Murder is a sort of a legal term perhaps for killing out of hate or fear or whatever, whereas this was a medical termination. It wasn't what you would typically... This is why at the start we're talking about what's the definition of abortion. This is not an abortion as people typically think of it, as a medically necessary termination for the life of the mum. And there are, stemming from our Christian beliefs, there's a range of conscience that people could have on what is right and wrong in a lot of these situations that are edge cases. And we wouldn't want to bind a person's conscience to a particular course of action, except where it's really obvious that you're basically killing a baby for no good reason, which is what the majority of abortions are, killing a baby for no good reason, no good reason. That's again a discussion for another time, but it's important that you understand our opposition to abortion and the course of action that we took together. And I mean, it's also important to say, sorry, I know I'm rambling a little bit, but at the end of it, we discussed it, we prayed about it, but I said the decision's yours, what you want to do. If you want to keep trying to going on and keep the baby as well, keep the baby alive.
You would have supported that.
I would support you. I didn't.
Even
I
if
didn't,
that meant my death.
Yes, yeah. If you wanted to, so some may be given that degree of faith to progress in that.
I wasn't.
I've heard of one situation where a fallopian tube ectopic pregnancy dropped down, and apparently that never happens.
I don't know how you say drop down. It doesn't drop down. It drops sideways.
Okay.
The tubes are
the
not
picture
up
in my
and
mind
down.
dropped. We'll say dropped. You know what I mean? It came out of that position of risk and harm miraculously. I don't know how often that happens. Maybe people know
Never.
and they can tell us. But yeah.
Never.
Yep. Anyway, it's nice to hear that miracles do happen.
Yeah.
So I don't know. I guess we should wrap it up there.
Yeah.
Yeah, hopefully there's some value in our conversation and our and more so your trial, that people can face some of the things with courage, and if they want to talk to you, you'd be happy for people to
contact me.
Yep.
Yeah. I was just going to say, like, if you've ever been in this similar situation and you feel guilty, don't. God understands this sort of situation. It's not a situation anybody wants to find them in to have to make this sort of decision. But if you decided to abort your child in order to save your life, if you've had an ectopic pregnancy or other life-threatening issue, stop feeling guilty. Give that over to God.
Now,
just let Him carry your burden for you.
And this is important as well, and I feel like a bit of a fool for not leading off with this, but what would you say to a person who their conscience may be talking to them right now about having had an abortion that they weren't justifiable in having?
I would say that God forgives.
God forgives? Just blanket forgiveness for everyone who's had an abortion? Or
Well, no, if you ask God for forgiveness and you believe that He is the Savior of your life, you know, you can have eternal life through God, through Jesus Christ who saves.
Yep.
And you ask for forgiveness, then God forgives you for that. That doesn't have to be a burden on your life any longer. If you're a Christian and you believe and you've had an abortion and it's not a justifiable one.
Yep. Even if you had that while you were a Christian.
Yes.
If you know it was wrong now, like, talk to God about it and trust that Jesus has taken the punishment for that sin as well.
And we're not here to judge you for it either. God is the ultimate judge, and if you've asked for forgiveness, that will be given.
Yep.
So, yeah, we're not here to judge. I'm happy to talk to you about it because, I mean, I've had an abortion myself, but...
Yep. If you're struggling with that guilt, or if you feel that God doesn't love you because you've had an abortion or whatever it is, remember that God sent His Son Jesus, and Jesus died for us while we were still ungodly, while we were sinners, while we were living in rebellion and hatred towards Him and no faith at all. How much more is He going to show His love for us if we are believing in Him and coming to Him in faith? So, yeah, we can't earn our salvation, and we can't do things like sin, a certain sin that will make us no longer have salvation. It's all done. Christ has done it for us. And that baby that you lost, either for the right reasons or for the wrong reasons, is, we believe, and we'd be happy to talk you through that in Scripture, from Scriptures where we believe that baby is with God. And we can, even if we don't know that, we can trust that God is good and delights to save sinners. And you know, Jesus said, "Let the little children come to me." We have confidence that God saves babies that die through abortion. But that's, anyway, that's a bigger discussion, and people do debate that as well. But talk with us. We'd love to informally counsel you through what we've worked through. You know, we're not trained counsellors, but we seem to have these sorts of conversations with people at different times. So, yeah. Anything else you want to add? No. Yeah, if you've listened all the way through, thank you for giving us the time. I hope it's been of benefit again to you. And if you know others who would benefit from hearing
Especially this
our
episode.
trial, yes, very much especially, please do share with them. And yeah, we're not desperate to have a huge audience or anything like that. We just want to share what we've learned through
Life.
our life and trials, and bring some of that to others, and maybe leave a little record for our kids to listen to when they're older, because memories and experiences fade as we get older. And
They're going to be so embarrassed.
yeah. Yeah. Anyway, thanks for listening, and we'll see you next time, I guess. Anything else you want to say?
No, hear you next time.
Hear you next time. Yeah, well, we'll put a picture. I might put a picture on the show notes of for the podcast episode of the mandarin tree. I think that'd be a nice little...
Yeah, go for it.
Yeah.
Now click stop.
Okay. Bye now.